Assalamu alaikum. So in this video, we'll be covering the neurosurgical anatomy of the trochlear nerve, going through the Rhoton neuroanatomy dissection pictures. If you haven't seen the previous videos, this is the fourth video in a series of videos going through the neurosurgical anatomy of the cranial nerves. Make sure to go to the playlist through the channel to watch the previous ones. So we'll start with this lovely illustration about the origin of the trochlear nerve. So we can see here this kind of a brainstem dissection with a lateral view. What you can see here is the superior and the inferior colliculus. This is just to give you an understanding. It needs a bit of imagination here. So highlighted in yellow is basically the trochlear nucleus, which is located in the midbrain, and that's inferior to the oculomotor nucleus. You can go through the previous video of the oculomotor nerve to understand more about the origin of the oculomotor nerve and the oculomotor nucleus. The fibers from the trochlear nucleus basically crosses in the midline, as you know, before it emerges posteriorly below the inferior colliculus to form the contralateral trochlear nerve. If we look at this picture, we're looking at the posterior superior view. And here, this is the apex of the vermis, which kind of partially removed so that we can, on one side, so that we can see the trochlear nerve. So here it is the trochlear nerve emerging just below the inferior colliculus. Moving into this dissection is the trochlear nerve will emerge posteriorly and then it will travel through the ambient cistern. So you can see here the trochlear nerve is going through the ambient cistern, and this is happening around the branches from the superior cerebellar artery. Here, this is a view from a supracerebellar infratentorial pathway or approach. And in this picture, we can't see the trochlear nerve, but it's just as a basic understanding of this midline picture, so that in the next picture, you can see the trochlear nerve. So in this one, we can see here the tentorium is higher up here. Those are the venous complexes. And you can see the pineal gland and the superior colliculi. And the trochlear nerve, as I said, is not seen in this picture. But if we move to the next one, and here it's a similar supratentorial, supracerebellar infratentorial approach, but we're going paramedian. And to see the trochlear nerve, we will have to push the brain, the cerebellum down with the vermis so that we can see the trochlear nerve. So here we are paramedian. You can see that the apex of the vermis is being pushed, and it's not covering the oculomotor, the trochlear nerve anymore, and as it comes from the inferior colliculus. Here, the posterior course of the trochlear nerve. So you can see as it comes at the inferior aspect of the quadrigeminal cistern, and then it enters into the ambient cistern. So quadrigeminal cistern, ambient cistern, and it wraps around the cerebral peduncle, along with the branches of the posterior cerebral and the superior cerebellar arteries, but mainly around the superior cerebellar arteries, but it's just to appreciate the relationship with the other blood vessels. Then here is a retroseg approach, or a retroseg view. You can see the trochlear nerve higher up in this picture, in the superior aspect, which is coursing through the ambient cistern, along with the branches of the superior cerebellar artery. And then the trigeminal nerve is here seen around the petrosal vein. And the rest of the the arterial supply and the lower cranial nerves all the way down. This approach is a petrosal approach, but it's kind of a combined supra and infratentorial. So to see that, the tent has been cut out. So this is the tentorium here, which is being divided, and you can see the trochlear nerve is here, and as you can see superiorly, the trochlear nerve is superior to the trigeminal nerve, so that's down, and that's up. What this one would be, this would be the oculomotor nerve. So oculomotor, trochlear, trigeminal nerve. Then this is a kind of a lateral superior view, and what's happening here is the trochlear nerve is going anteriorly, so that's posterior, emerging all the way through the cisterns, as explained, along the lateral edge of the peduncles, within or around the blood vessels, as mentioned earlier, and it goes all the way anteriorly and it goes into the edge of the tentorium. So trochlear nerve goes into the cavernous sinus through the tentorial edge here. We will have further pictures later on that you can appreciate this anatomy a bit more. That's near the posterior clinoid process, and that's lateral and posterior to the entry of the oculomotor nerve. So the oculomotor nerve enters into the cavernous sinus a bit more anterior and medially, while the trochlear nerve will go more lateral and posterior. Here is the subtemporal approach. You can see that the temporal lobe is being elevated so that we can see the trochlear nerve. So the trochlear nerve is there, highlighted in yellow, and that's medial to the tentorium. And that's very important in a subtemporal approach, that you don't damage the trochlear nerve, especially when going towards the edge of the tent. And it passes below the tentorium, which is kind of covering it here. In the next picture, we will cut through the tent so that we can see the rest of the pathway. And further, that's the tentorium here, and anteriorly and medially you can see the oculomotor nerve as it goes into the cavernous sinus. In this picture, that it's a similar approach, but we have cut through the tentorium. You can see the trochlear nerve here, as explained earlier, and as it approaches the cavernous sinus, again posterior and lateral to the oculomotor nerve. So you can appreciate that here: trochlear nerve, oculomotor nerve, and more inferiorly we can see the trigeminal nerve. So this is inferior and that's superior towards the temporal lobe being pushed upward or elevated upward. In this picture, here is a petrous has been taken, the anterior petrosectomy is done, and then the tentorium is being divided so that we can see more of the medial structures. So you can see the trochlear nerve is identified, and you have to preserve that as you're cutting through the tentorium. Again, you can see the oculomotor nerve superiorly and the trigeminal nerve inferiorly. This is a lateral view, as this is anterior and this is posterior. Brainstem is seen here. The trochlear nerve is seen here, as explained earlier, as it's going into the tentorial edge. And if you appreciate in this picture, it's going through the ambient cistern here to the edge of the tentorium, which is, again, the entry is a bit more lateral and posterior to the oculomotor nerve, which you can see here. This is a lovely picture which explains that relationship. So this is the edge of the tentorium, and that's the oculomotor nerve as it goes into the cavernous sinus. In the next images, we will cut through those layers of the dura so that we can see the rest of the course as it goes into the orbit. Here, that's kind of a superior view. We can see here, this is the optic nerve higher up, then the oculomotor nerve, and then what's highlighted in yellow is the trochlear nerve. Again, it's entering into the cavernous sinus, lateral, posterior, and inferior to the oculomotor nerve. That's the oculomotor nerve, which passes, as explained in the previous video. If you haven't watched that, you need to watch that through the link above, about the oculomotor nerve. So passes through what? Through the oculomotor triangle. And then we have the supratrochlear triangle, which explained before again, which is above the trochlear and below the oculomotor nerve. And as we have a supratrochlear triangle, we will have an infratrochlear one. The infratrochlear one would be below the trochlear and above the first branch of the trigeminal nerve. So always remember that relationship between those three nerves: oculomotor, trochlear, and trigeminal. And here you can see the infratrochlear triangle, which again, as said, between the trochlear and the first division of the trigeminal nerve. Here is the superior view, posterior view to see the cavernous sinus. So that's the cavernous sinus being exposed. You can see the oculomotor nerve, trochlear nerve as it's coming inferior to the oculomotor nerve and it crosses on top of the oculomotor nerve. And finally, the trigeminal nerves, the abducens nerve is here, and then the trigeminal nerve, the biggest one, with the first branches going again in relation to the trochlear and oculomotor. In this picture, we are looking into the cavernous sinus from a lateral view, but the dura is being removed. Again, we have seen a similar kind of picture in the previous videos. Make sure to watch those. we can see here the trochlear nerve, and then as it goes into the cavernous sinus through a small cistern which lies below this tentorial edge. This tentorial edge has been cut here, so you can see the oculomotor nerve, which is this one, as it enters into the roof of the cavernous sinus through this oculomotor cistern. In this picture, the trochlear nerve, you can see, is going in the pathway, again, just to repeat that, through the ambient cistern all the way anteriorly, inferior to the oculomotor nerve, and then it crosses on top, superior, and until it goes into the superior orbital fissure. In this one, okay, again, this trochlear nerve courses inferior to the oculomotor nerve, then goes superior to it. The angle between both, as we said before, between the trochlear and the oculomotor is called the supratrochlear triangle. And then the angle between the trochlear and the ophthalmic nerve defines the inferior infratrochlear triangle. In this triangle, you can see the dorsal meningeal artery. Here, the superior view of the orbit. We can see the trochlear nerve here, highlighted in yellow, and then the oculomotor nerve. And again, the trochlear passing superior from laterally, superiorly to medial to the oculomotor nerve through the cavernous sinus, and then it enters the orbit through the superior orbital fissure. Then in this picture, we will again, superior view, you can see the trochlear nerve as it turns medially and goes into the orbit to supply the superior oblique muscle, SO4. This view is lovely so that you can see and appreciate what's going inside the annulus of Zin and what's outside. What's outside is one of those is the trochlear nerve. So here the clinoidal processes and the lateral wall of the orbit has been taken out so that we can see what's happening. So you can see the trochlear nerve is passing to the orbit but remains outside the annulus of Zin, which is here. Also, there is another nerve which goes with the trochlear nerve outside the annulus, which is the frontal nerve, while the rest of the others, including the oculomotor and the V1, will go through the annulus of Zin. I hope you enjoyed this video. Stay tuned for the next one. We will be going through the neurosurgical anatomy of the trigeminal nerve. Please let me know in the comments below if you find those videos useful and what other parts of neurosurgical anatomy that wants to be covered in this video series. Thank you.